Good afternoon and welcome to the Cardinal HCM Datasheet Forum for localities that are supported by the Local Choice Program. My name is Jolene Christensen and I will be your facilitator today. Thank you for taking time out of your busy schedule to join us. Our forum today is scheduled from 1 p.m. to 2 p.m. All attendees have been muted to avoid background noise. We are recording this session and this presentation, and the recording will be sent to everyone who was invited or is attending by the end of this week. So to get us started on our agenda today, the TLC Datasheet certification is first, and we will be showing a demonstration of that. Then we have some of the TLC representation from the Office of Health Benefits. They are here to answer any questions. We'll chat about some training materials, both generally and also specifically for the Datasheet certification. We'll touch also on accessing and logging into Cardinal HCM. We'll do some additional support information, and then we'll wrap up the meeting. So a lot to cover in the next hour. Now I'm going to pass it over to Sarah Harrell, our benefits team lead. She'll be walking us through the demonstration for the Cardinal Datasheet process. I'm going to go on mute for just a minute while we pass over the presentation, and then we'll come back to me at the end. Thank you.
Hi, this is Sarah. Thank you for joining. We are going to step through the processes needed in Cardinal to get your Datasheet certified. So I'm going to begin by navigating to the TLC Datasheet. Now, if you're logged into the system and you are navigating along with me, if you notice that you don't have access to the page I'm going to, then there may be something wrong with your security, and Jolene will cover how to get that addressed at the end. So I'm going to navigate to the benefits folder. And then I'm going to navigate to the employer information folder. Okay, and my option is the TLC datasheet is the first one in the list. When you come in, you're going to select your datasheet. If you just click on the search button, the datasheet that you have access to will be returned to you. Okay. So today we're going to pretend that we're the Amherst County Service Authority, and we're going to go through the steps to get their Datasheet certified. All right, so the first thing you'll notice is that you're going to see a 7/1/2023 effective date. Those were put out by a clone process for everyone. If you're going to make changes to this year's datasheet, you're going to start by clicking on the plus button to insert a new row. Now you'll notice that when I do that, some fields are available for me to change, like total employees enrolled, and some fields aren't. So the effective date, the effective status, the description, the group type, those are all locked down. If any of those fields has changed for your group, you would need to reach out to the TLC department or the TLC group to get any of those fields updated. But you're going to key in the total number of employees who are currently enrolled. You're going to turn on premium averaging if that applies to your TLC. And then you're going to scroll down a little to the plan selection section. And what you'll notice is that these are the plans that you are currently offering. So let's say that this group has decided that they are going to replace the Key Advantage plan. So we're going to remove this Key Advantage plan. All right, and we always remove the preventative dental along with it. We're going to remove there. And now we're going to add the new plans that we were going to offer this year. So we'll come to the lookup. Let's say this year you're going to offer the Key Advantage 250. So we're going to add the Key Advantage 250 by clicking on the description. And you always need to offer the preventative dental as well. So we'll go in and add a row for that and click on the preventative dental plan. So now you can see we're offering this Medicare plan and these two plans to your population. The Key Advantage 250 comprehensive dental and the Key Advantage 250 preventative dental. The next part of the sheet is going to ask you about contributions to an HRA HSA. If your group doesn't offer this, you can ignore it. If they are, answer yes or no as to whether or not you're going to put employer funds, excuse me, into those accounts. So let's recap where we're at. We're on our TLC data sheet for 7/1/23. All right, we've inserted a new row so that we can make some changes. We've removed one set of plans and added the new plan that's going to be added this year. And now we're in the department section of the data sheet. So the first thing we're going to look at are the rates. What's going to pull in are some rate information for all of the plans that you have, and then the different coverage types that are offered. What you need to do is key in what the employer rate is going to be for each of these plans. Now, the employer rate must be equal to or greater than the MEC rate, which is shown on the page for you. If the rate that you key is lower, you will get an error message. So we're going to simulate that. I'm just going to paste these in. We're going to pretend that the employer rate for all the plans is the same. If I try to say okay right now, I'm going to get a warning because the rate that I keyed for the employee only coverage is less than this MEC rate. So we're going to increase this to something that's higher. And now it'll let me save this rate information. Okay, so now my plans have been set, my rate information is set. Let's look at the classifications that we're going to offer coverage to. I'm going to click on the view all link so I can see all 7 at once. And you can see the different employee classifications are listed out as to what you were offering in the past and whether they're going to be a direct bill or a group bill. You'll notice that when you click on the COBRA classes, only direct bill is an option because that's the change for this year. But for full-time is group bill, you can see that these are sort of restricted based on the changes that you can make. Medicare retirees, you've got some options. We also have a new employee classification that you'll see on the sheet this year, and that is this last one. It's called Survivor of Employee Extra Month of Coverage, and that will give the surviving dependents. Okay, the TLC group will talk about the changes that are coming with that, but if you needed to make any changes to your employee classification, you would do it in this section and you'll indicate what their billing method is going to be. Okay, so we'll say okay to that. And now we'll look at the contacts. This is a good time to take a look and stop and ensure that you've got the correct contact information for your group. If you need to make any changes here, you can do that at this time. You can look up by EIN and pull a new person to be the contact if the person displayed is no longer. We're going to say that there are no changes here, so we're going to say okay. And now I've gone through and I've hit all the different sections of the data sheet. It's time for me to click the Validate Data button. And it's going to tell me, yep, your plans, rates, contacts, that was all successfully saved. Everything worked on the page. And once you've gone through this test, then you can do the certification piece. The certification piece is simply updating the radio button from no to yes, and then scrolling down and clicking the Save button. It's going to update this with information on who did this, right? And the data sheet is now locked and finished. Okay, if I needed to make another change, I could insert another row, and then I would go through the certification process again. So let's just summarize what we've done. We went from the benefits, employer information, and TLC data sheet. I clicked search in the lookup to find my data sheet that I have access to. You can see when we come in now, we still see our 7-1 row, but now it's got the new effective sequence that I added. And when I scroll down, I can see the Key Advantage 250 plans that we added when we made our change. So I've put in all the plans that are going to be offered. I've keyed rate, class, and contact information for my group. And then I've gone through the certification step and saved. So those are all the steps that you need in order to certify your data sheet in the system. We're going to take a brief pause and then we'll look at the questions you've submitted and the representatives from TLC will give you some answers.
All right, thank you, Sarah. So we did have a question about the PowerPoint and recording. We will be sending those out this week to everybody who's in attendance. So just hold tight, you'll get an email from us. Sarah also just explained again how to navigate to this page. Plus, if you use the job aid, which we're going to reference later, it will show you those navigation steps. So we're going to send you with that link today, and then you'll also get it in this in the PowerPoint that we're going to send. We did have a question related to, will the current plans auto-populate on the data sheet?
Yes, the plans that you're currently enrolled in and offering will be available in the data sheet when you go in. So if you're not changing anything, then you're really just going to go in and insert that row so you can update your rate information, save, and certify.
Great. Then one more time, just so everybody's looking, can you show us how to get to this page?
Yes. Okay, so we're going to start from the very beginning. I've just logged into Cardinal. I'm going to click on the nav bar icon to pull up my navigator. When I get to that navigator, I'm going to click on the benefits link. After the benefits link, I'm going to scroll down to employer information. And then the TLC datasheet is the first choice there. So it's benefits, employer information, TLC datasheet. Just click on the search button and the TLC you have access to will come up. And the plans that you were in last year will be pre-populated. If you've made any changes and saved, you'll see your changes.
Great, thank you. We had someone who said, hey, my page doesn't look the same as what you're showing me. And I think we're going to address that a little bit later in some slides. If you've lost access or for some reason you don't have access to the data sheet, we're going to cover that in a couple of slides. We're going to talk about some just general training materials. If you're new to Cardinal or you didn't read our email or get our email, if you were part of release 3 in September or earlier releases, we have some web-based training out there available generally for the population. We're going to share these links with you, but there's a couple of things that we really like. There's this intro to what Cardinal HCM is, a navigation, Cardinal reporting, as well as an HR read-only overview and a benefits read-only overview. So lots of materials at your fingertips to get a general understanding of Cardinal. For today, the Cardinal HCM job aids provide step-by-step instructions, and we're going to share this link shortly after I'm done talking here and we pass it back over to the local choice team. You will want to follow this job aid to help you walk through what you just saw Sarah demonstrate for you. So it's screenshot by screenshot and very specific directions. So I'm going to encourage any of you who have any questions to use this job aid. Two other great resources are generating the HCM report for those of you who are doing your monthly reporting and reconciliation, as well as queries. We have a new page on the Cardinal website, and we're starting. This is just out of the hopper. We're going to continue to evolve this page, but directly for all of our locality core users, and there's one for centralized localities and some quick links for you as well as decentralized localities. Now, this is a topic that we did touch on in our December demonstration when we were going through ACA, was about accessing and logging into Cardinal. I wanted again to go over the two types of users in Cardinal. First are the employee self-service users. These are locality employees who can view and update their personal information in Cardinal. Access for these ESS users is granted automatically when an employee is hired. So when you send in those forms to TLC, if they're keying them for you, as that information is entered into Cardinal, if there is a valid email address, then that individual could potentially log into Cardinal and complete enrollment and other information. So that's the one type of user. They have the really basic type of access. And then core users is really targeted for all of you. When we sent the invitation out, we sent it to anybody who had datasheet access at that locality. I know that there were some localities who were missing that datasheet access. You may have heard about this forum during the TLC roadshows that have been happening in the last week. Also from the newsletter they sent out late in February. So core user access is granted based on your role at the locality, and it's typically because you're an HR and or a benefits professional who's responsible for the healthcare process at your locality. If you believe that you somehow your access is incorrect, there's a couple of things we could do. On this bullet, we say you should reach out to TLC, but I want to go into more before you do that. As a reminder, for anybody who has core user access, you would need to fill out if you're a new employee who needs core user access, or if you need updated core user access, you would need to follow the Cardinal security process, which is you'll submit the locality security access form to tlc@dhrm.virginia.gov. We'll send you this link, but it's on the Cardinal website under the security page, and there is a section just for TLC locality users, and here's the form here, the locality security access form. It's not easy, so you will want to use your instructions on how to fill out that form, or also work with TLC for assistance. The TLC group, once they receive your form, they're going to review it and approve it and get it over to the Cardinal security team for us to process it. So this is not an overnight process. Do not send this in on April 4th and expect to have access by April 5th. But once the security team has processed your form, you will get an email from the Cardinal security team letting you know that either your access has been set up or you've had additional access set up, and it will come to your email. If you're wondering what type of locality you are and you're looking at potentially that new website page we just set up, there are two different programs or two categories that determine your usage. There are 350 centralized localities. So most of you who are on the call are a centralized locality. Your benefits are administered by TLC and managed centrally via forms for the most part. There are 3 decentralized localities. They went through additional training and they administer their own health benefits functions directly in Cardinal. If you have any questions about this, don't hesitate to contact TLC for more information. Now, one thing, as you're getting emails from Cardinal, or if you're getting emails from TLC, is we had encouraged localities to safe list the following domains or email addresses. I'm going to just skip over the slide just briefly, but here are all the domains that you might be getting emails from. So both TLC and Cardinal from time to time send newsletters from this public.govdelivery.com email. So if you haven't safe listed it, it may go into your spam. So always keep an eye out for that. Cardinal itself sends out some automated emails, and that would come from @cardinal.virginia.gov. And then finally, when you get our security email, it would come from @doa.virginia.gov. And then we list the very specific email addresses you might be receiving emails from. Now, to access Cardinal, it can be accessed over public internet using my.cardinal.virginia.gov. Locality users will need to register with the following information. This is a one-time only process, but you will need your 11-digit Cardinal employee ID. If you are having an employee at your locality log into Cardinal and set up anything or do open enrollment, you have to, as a benefits or HR professional, share this information with them and ensure their primary email address is on their record. So for many of you is to make sure that that was on the form that you sent into TLC. Unfortunately, the registration process is very complex. In order to protect your access to Cardinal, and we encourage you not to do that on your own or to try to self-guide your way through it. We do want you to use the Cardinal Registration Quick Start Guide. The registration process itself from beginning to end could take up to 15 minutes. It's not easy. But once you're registered, you can log into Cardinal using your email address and the password you created during the registration process. A couple of password tips. If you've entered your password incorrectly, you will be locked out after 3 attempts. You can use the forgot username and password, and we encourage you to use that. That's directly at the my.cardinal.virginia.gov. And this is the big one. If you listen to nothing else related to training and logging on, as a core user, everybody who's on this call is likely a core user assisting their localities with health benefits. You need to log in and reset your password every 90 days. If you do not, you will lose your core user access, meaning you cannot update your data sheet and certify it, or your ACA, or your monthly reconciliation that you need to do. You'll have to submit a new security form. So you'll need to go back up through that process, submit that form back into TLC to get that set back up. I know that there's at least 65 localities who have lost their data sheet access. And so you'll need to work to get those security forms in or with TLC so that you can complete this by the due date, which is April 5th. Finally, system timeouts. In order to protect you and the data, Cardinal times out or terminates any session that's been inactive for 30 minutes, like being logged on to your bank. You'll get a warning 2 minutes before that occurs. You'll receive that warning if you're in that browser. So if you're over in Word or PowerPoint, you may not receive the timeout notification. So encourage you to stay active in those browsers. If you are working in Cardinal, always save your work as often as possible. And if you do have multiple windows open, the user will be timed out of all of those windows. So that's really our quick talk on login access and training materials. I assume we have a lot of questions. Sarah, can we pause and go to some of those questions? So from Big Stone Gap, it looks like they're logged in and they're on their screen looking at premium rates and preparing to enter the employer rate. However, it's not allowing me to enter the information. Is the TLC datasheet active so we can begin making updates?
Yes, the TLC datasheets are all active. You do need to insert a new row though to make your changes. So we've seen this question a few times. If you're clicking on the rate button and there's nothing available for you to edit, make sure at the top of the page you've inserted a new row.
All right, one of our plans selections is not in our data sheet page. Where is early retiree? All right, so Jen, it would be in the classification section. I'm going to have you go ahead and look at that. If you do have a question after that, we'll let you write us back. Can we change our election rules here?
Yeah.
I'm gonna look into Freddie. Can you?
Okay, sure.
Can we change our election rules here?
Yes, that's part of the data sheet process. And under what Sarah has already covered under the classifications, you can make any changes that you'd like, just like you've done in previous years.
Great. Do we need to send anything out for Cobra?
So some of you may have been a part of the TLC regional meetings already. So we are moving to PayFlex for Cobra administration effective July 1st. And when you say send out anything, we may need you to email the TLC box to be more specific, but the administration of Cobra will be moving to PayFlex July 1st. And I don't want to give you a blanket answer if you're talking about a specific notification. So if you can get a little more detail around that question before we answer.
All right, so if we don't answer your questions today, you're going to write TLC and give as much information as possible, where you're from and your specific question for us to follow back up on.
And if you could put in the subject line TLC Forum, FORUM in the subject line, that way we'll be able to filter that out and get a response back so it doesn't blend in with all of the other day-to-day inquiries.
Great. Are the comprehensive dental and preventative dental two separate plans?
Yes, that hasn't changed. Again, that's each group has to elect comprehensive and preventive. And that's been a part of the rate structure and a part of the benefit structure as in previous years, and it will continue to be.
All right, we have one locality who asked if we can add a contact person. I think we could take this a couple of different ways. Who wants to jump on the response for this?
Sure, I can go for a contact person. So that hasn't changed. If you want to group data change form, so for your contact that can be submitted to TLC. Now, I don't want that to get confused with a security access form. Those are two separate and distinctly different things. So I believe we've already covered how you would do a security access form, but yes, you can still update your contacts through the normal group data change form and send that to the TLC email.
Great. What are the rates? Are the old rates that we insert?
So not exactly sure exactly where that question's going, but as far as what has populated in, that's bringing in your new rates effective July 1st, 2023. So that's what's being brought into the data sheet now. So your current rates will be there, and you may be able to reference your previous TLC data sheet if you're looking for your current rates.
All right, great. I've got a question on somebody who's lost their access. So I'm going to answer everybody. If you've lost your access, this is the security page you're going to go to. It's cardinalproject.virginia.gov/security, and that's where you can pick up that form if you don't already have it. Will jurisdictions be able to update participant address on the Cardinal HCM application? When I try making an address change, I receive a message that says highlighted fields need to be completed. However, there are no highlighted fields on that screen.
So if that happens, you would enter a VCC ticket and the Cardinal support team will address your issue.
I have a Cardinal account set up, but I do not have the navigation tab on the right top corner.
It sounds like you only have self-service access. If it's been more than that 90 days mentioned, then you've lost your core access. You'll want to go through the process and fill out the form that's been linked in the chat.
All right. Do we have to inform TLC when we make a change to the Cardinal website? I think we're talking about the Cardinal application. I know, so confusing. We have a website that we refer to, the Cardinal website, that is the support website for the actual Cardinal system. So I think we have an individual asking, how do they inform you if they're making updates to the Cardinal HCM application, potentially to the data sheet, but maybe to user data?
Sure, you'd contact us through the normal channel of the TLC email box.
Can a locality add Advantage 65 plus DV at any time? And do changes under that plan affect the locality rate in the future?
So that is a election that you would make at renewal and not something that you would do off renewal. So you can't elect it at any given time. That's something that you would make a choice of at your renewal date. For most groups, it's July, and for some, it's October.
Is there a way to import the rates without having to manually enter them?
Not at this time.
What do I need to email if the drop-down box does not show under rates and classes?
So if you've made sure that you've inserted a new row on the page, if you go to the rates or the classes link and you can't edit anything, then you would submit a VCC ticket, but make sure that you've inserted that new row first. That's crucial to be making any changes anywhere on the data sheet.
All right, maybe we could circle back in and watch you one more time at the end. Insert that row, just because that's new for a lot of you. I definitely want to make sure that you all see that. So we'll get ready to send that back out. In the meantime, the information about submitting a Cardinal ticket was just sent out. So the MEC rate is the monthly employer cost. The MEC rate is the monthly employer cost, MEC.
So that's the minimum essential coverage amount.
Minimum essential coverage. Okay, let me write that back so everybody knows. Minimum essential coverage.
So some of you may be more familiar with employer contribution. So the minimum employer contribution.
So minimum essential coverage or?
The minimum employer contribution.
Minimum employer contribution. Right. Is this different from last year? Are there still options regarding enrollments and election requests?
I take that to mean that you're referring to the classifications and the potential rules. So certainly you still have those options. You can make changes at renewal. If there's a different interpretation, I didn't answer your question, you can email us at the TLC box, but I believe that's what you're referring to.
All right, we had a question about how to change rates. We'll go back into that when we do a quick little demo at the end. Just scrolling, we have a lot of questions. We probably won't get to all of them. The TLC data sheet completion considered our renewal?
The answer to that is yes.
Where do we find a description of the acronyms used? The MEC, we already discussed earlier, the HRA or the HSA? So we have this question about finding descriptions for the acronyms used on the page. We just talked about MEC. It also looks like we have HRA and HSA.
Sure, HRA, Health Reimbursement Account, HSA, Health Savings Account. And those are two acronyms that most of you are probably familiar with, because that's something that's also showed up on data sheets in the past.
All right, I've sent a couple of emails to the help desk because I'm unable to get into Cardinal. I've tried just again and I cannot access it. I've clicked the reset password option, but the system is still asking me a security question I don't believe has been set up. If you did not register at the beginning, and I'm guessing you would have remembered it because it takes you like 10 or 15 minutes. If you don't recall doing that, then we want you to send in that VCCC ticket. My guess is there's a couple of things going on. Maybe your email, the email associated with your access isn't correct, or for some reason, there's something else going on. So I'm gonna just paste in a quick little security thing, response to get you to submit a ticket, and include as much information. If you don't think you've ever logged in before, the Cardinal security team can see that right away and can respond back to you and get you set up for success. But the key thing, if you're sending in a help desk ticket, you have to include Cardinal in the subject line. We love for you to include more information like Cardinal, can't access, can't log in, never logged in. Any information that you can to help us understand as much as possible. But Cardinal being in the subject line is the only way it gets routed to us. All right. We have a lot of other questions. I'm going to see if I can answer a couple of them. But in the meantime, I'm going to pass it back over to Sarah. She's going to show us again how to get to the page, and then also remind us how to insert a row to add the information we need to.
Okay, so we're back at the Cardinal homepage. We're going to just sort of step through things again and try to answer some of the questions that we've seen scroll by. So I'm going to click on the nav bar icon to get the navigation menu to come up. And from there, I'm going to select Benefits, Employer Information, and TLC Datasheet. I'm going to click Search, and the datasheet I have access to will come up. So let's just look at the page for a second. Again, there's some group details. Everything from waiting period up is set at TLC level. If you're going to change that, you're going to reach out to them. As I scroll down, I'm going to see the plans that were brought in from last year. These are the plans that were previously offered. Those may not change. You may be offering the same plans again this year. And then in the department section, I'm going to see a few different links. So let's click on the rates link. And you can see that right now on the rate link, I can't make any edits. None of this is available to me. And that's because I didn't insert a row when I first came in. So let's close this window. We're going to scroll to the top and use the plus icon to insert a new row. All right. So now when I click on the rate information, you'll see that I can now edit the employer rate field. These total rates have been pre-populated by the system based on the new 2023 rates. And so you can see right now the employee rate is set to 100% of the total rate. If I key an employer rate of $100, then the employee rate goes down. So that's how you update your employee rates. It's by updating the employer rate. The total is set, at a organization level, right? And so you get to determine how much of the coverage the employer is going to cover. We talked about this MEC rate. My rate for this employer rate has to be higher than the MEC rate or I'll get an error. So if at $100 I try to save, it's going to say, nope, that is way too low. You have to be above the $756. So we'll make this one $780, and that drops the employee rate down to $166. You can see that this MEC changes based on the coverage level. So the 780 is going to work here, but it'll be the same, so maybe we'll go higher on this one. We'll say this one's going to be $800, right? And then when I key that $800, the employee rate goes down, okay? So we're just going to key these and say, okay. All right, on the classifications, if we hadn't, we wouldn't be able to make any changes here if we hadn't inserted the new row, right? But this is available to us because we're working on that new row that we inserted. Okay. When I get to the bottom of the page, I've keyed everything. I've made all my changes. I'm going to click the validate data button, and it's going to tell me you've done everything properly. You can now finish the certification. I won't be able to do this certification piece until I click that button. Okay. I'm going to say the data is certified, and then I'm going to click save. Okay. Now that I've certified, my information's been submitted and the system assumes that you are finished. If you need to make a change after that, you need to submit a VCC ticket to ask us to back out your certification, or you won't be able to make any changes. Okay. So I think, again, it's from when you're starting at the home, you're going to go to the navigator, you're going to click benefits, employer information, and TLC datasheet. And then the most important thing to remember is that when you come in, to click that add a new row button so that you'll have access to make changes to your rates. Okay, even if I do that now and I come down to rates, it's all locked out because I've certified. Okay, so once you're certified, you're certified.
Great, thank you, Sarah. I'm going to ask some other questions while you pass back the presentation to me. A couple more slides that I'll present. When you refer to new hires, are you referring to TLC new hires or new hires at the various jurisdictions?
So when we refer to new hires, we're referring to TLC new hires. Not exactly sure when you mention jurisdictions, what you're referring to, but for the purposes of this is TLC new hires.
Right. All right, I'm going to scroll down to additional support just quickly. We do have a lot more questions and we'll stay on to try to answer a few more of them. TLC support, we have their email address here. I'm sure you know it very well. But also when you get this PowerPoint, there is a great resource for all the e-news that are listed. So if you missed an email, which is very easy to do, you can click on this and see everything that was sent recently. And as a reminder, this data sheet entry is due Wednesday, April 5th. So I know they won't let you forget that due date. We've talked a lot about, VCCC or help desk tickets. This slide is all about the how-to. You need to send an email to VCCC with Cardinal in the subject line. And then we provide the following guidance below. We would really like to have your locality name and number if you have it, your first name and last name, an email address and phone number that you can be reached. We need you to provide detailed information. It is best for you not just to send us help, can't log in, as much information as possible. If you can't log in, have you ever logged in? Or if you're having problems certifying, if you could give us as much detail, I navigated to this page and nothing changes, so that we can provide as succinct support as possible. Any error messages you're getting, keystrokes you've tried to do, and screenshots. Here's some tips for sending screenshots. Since it goes through this automated tool, we encourage you to attach the document as opposed to pasting them in the body of your email. And as always, do not send sensitive personal information in your screenshots, blur it or crop it out. Also, when you're sending tickets, help desk tickets, or sending an email to the help desk, do not send them encrypted. That system that creates all those tickets doesn't know what to do with encrypted emails. So don't use Virtu or anything else like that. That's why we want you to crop that sensitive information out. And then finally, don't copy other mailboxes. So this is hard because you're looking for help and you want it right away. But if you send it to TLC and you send a Cardinal ticket, you've got both groups working on it at the same time. So pick your group, go with it. If we think it needs to be sent to somebody else, we'll pass it over to TLC or ask you to reach out to them. They'll do the same for us. And that'll cut down on just, multiple people working on your issue and not being able to help other people while they're doing it. All right, so I'm going to go back to questions and see where we're at. All right, I've just logged in and was able to access my data sheets. In previous years, I had to certify for the school since they piggybacked under our group. I used to have to include all of our information under the 3 groups, but I don't show the group on the data sheet for the school. Has it changed where I have to fill out the school data information and rates? Are the group administrators for the whole group? But they do have a benefits administrator. That's a really complicated question coming from Mary Dodson.
Yeah, that is a complicated question and one that we probably won't be able to answer in this form, but it is something that you can send to the TLC email box, and it may require a conversation, but let's start with the TLC email box.
All right.
Freddie, we got a question in that if my renewal is in October, is my data sheet due in April?
It is not. That's a different, that is a different time frame for October, and August 22nd for October groups. And you can rest assured we will be communicating that profusely to October groups.
Great. Thank you for that clarification.
We've also seen a question pop up from a number of you that you're seeing duplicated plans listed in the data sheet. If one may be for comprehensive and one may be for preventative, but if you're seeing the exact same plan listed more than once, if you could send in a VCC ticket and we'll take a look.
Is there a place for employee participation counts?
Yes, on the classifications.
If you've certified, you can't go back and make changes if needed.
In the system, you cannot. You'll have to reach out to the VCC team, and the Cardinal support team will have to remove your certification. So please, certify once you're certain everything is complete and accurate.
Is there a change in the renewal deadlines? The last email from DHRM says April 1st, not April 5th.
Yes, so that is a change. So April 5th is the new date, and we thought it was only fair to add a couple additional days since we were just holding the forum today. And we did send an e-news that referenced that also. So I believe I saw in the slide about the referencing TLC e-news, a wealth of information, because a lot of stuff we've already communicated out.
Jolene, can you answer what a VCC ticket is?
A VCCC ticket is a help desk request that is going to be directed to the Cardinal team. The VCCC is a help desk that is supported by VITA. VITA is the primary provider for executive level agencies. They do support 65 agencies, and Cardinal uses the VCCC tool to monitor and track all of our tickets through. So instead of having you email us, we're asking you to email VCCC, and an automated ticket will be created that will be routed to us as long as you have Cardinal in the subject line. A question about, is the total employees enrolled accurate, or do we update with how many on billing and the waived number is total employees enrolled?
So you should have the total employees should include waived, but there should also be a distinction between those that are waived and those that are active.
All right, great.
Jolene, one quick thing. I think that what we can do is in the answer to this question, we will also include a query that can be run that would give you your totals that would be accurate. So that way it'll be a double check. You can double check against your bill and you can see what's in Cardinal, who's enrolled, who's waived. So we'll include that with the question answers.
Great. All right, we're gonna come back for one more question, I think.
So this has to do with, how do you know you've completed the process and how that's different this year than it was in the past? So in the past, you would have received a PDF of your data sheet. This year, that exists in Cardinal, so there is no separate PDF. If you navigate again to the benefits, employer information, and TLC data sheets and scroll to the end for your data sheet, if you've certified, you'll see that certification information. The name of the user who certified and the date and time they did it will display at the bottom. If that information is there, then you have completed the process for this year. If you don't see that certification information, then it still needs to be completed and certified for your group. But there's no confirmation email and there's no PDF. That information just exists for you to view in Cardinal.
All right. I know that we didn't get to everybody's questions, but if you do have a follow-up, we're going to encourage you to follow up with TLC. We also do have all your questions. We'll download them and look at them. And if we feel like there's additional information on the PowerPoint that we want to include, we're not going to send that PowerPoint out this afternoon. We're going to take a little bit of time, but you should receive the PowerPoint tomorrow on Thursday, as well as the recording, if not by early on Friday. We encourage you to use the resources that we are providing in that PowerPoint, which will include the job aid for the data sheet certification. And you'll want to follow that job aid because it's your first time if you're doing this renewal, if you're in this April renewal. So again, thank you for your time. You're going to get this recording as well as additional information in the PowerPoint. Thanks.